HP balloon below the knee, is there really significance in long-term patency? TLR.
Definitely. Thank you, Ahmed, and thank you, Dr. Mahmoud, for the kind invitation. I was asked today to talk about the role of high pressure balloon in the below the knee intervention. So, as a start, we have many application about the outcome of the non-compliant balloon in the treatment of extremity below the knee, with showing very good results at the early and mid-term period. I will make it very short. They concluded that we can utilize this kind of balloon safely and with a good outcome in the below the knee segment. So with this Singapore publication showed the same result. So these balloons are doing well in the clinical aspect. But for better understanding, we have to revise the basic science again. So from the plus law, it's all about tension and pressure and radius. And as we show here, the difference between the compliant and semi-compliant and non-compliant balloons, the action during this inflation. That means that when you stabilize the non-compliant balloon over the semi-compliant balloon, you have a pressure gradient over the vessel as the same as intended all over the segment balloon. Again, this is the difference between the non-compliant balloon and semi-compliant balloons and the compliant balloons, showing the same that the material differs too. The kind of material used for ballooning, the folding of the balloon are also very important. But back to the basic science again. If we have to stabilize different factors like this seen in this publication about the influence of balloon design, plug material composition, and balloon sizing in acute post-operative angioplasty outcome. This publication found that non-compliant balloon during inflation shows a lot of stress over the vessel wall. But the most important conclusion from this study, when you have a stabilization of all this, that the size of your dedicated balloon is matter. The size is a very important. That's why when you use IVUS in below the knee, your outcome is much better than without IVUS. IVUS studies showed a very good improvement, but is this the only reasons to improve your results just having more sizing? We heard here from our moderator that the recoil dissection restenosis in the below with the pupa is very common, and that's why pupa is not advised anymore. But when you go to see what we are doing with pupa, do we know exactly what we are doing? The vessel preparation to optimize your results, you have many factors to standardize. First of things, the importance of inflation technique. You have to standardize the inflation technique. Will you have a rapid inflation, slow inflation, gradual inflation? This is differ, and this is matter actually. Another thing, the inflation time. We might have some studies about the inflation time and how influence the inflation time your outcome. And when you see here deeply in the transfemoral and femoropolyteal segment, we have this publication that concluded that balloon dilatation, prolonged inflation, more than 3 minutes or even 3 minutes, are more effective in the initial and midterm our outcome for this inflation, even from the coronaries. When you have a prolonged inflation, that gives you in another improvement in but when you look deeply, do we treat all the vessels with the same manner? We have the same morphology? No, we have different morphology from different vessel morphology, from different erosion and from different plaque erosion and from different calcification, medial or extramedial or complete calcification. So we have a different vessel morphology, and this should be kept in mind. Even if we looked at this publication about the pathology, the critical ischemia, comparing the plaque characteristics between anterior and posterior tibial, you will amazingly find that these plaque characteristics are completely different from anterior and posterior tibial artery. This means that if you want to standardize your treatment, even for the below the knee segments, is that might not be completely uh, significant. So the question again. Do we know what we are doing below the knee now with all this kind of material? The answer is after 50 years, more than 50 years of pupa, do you think we know how to do it correctly? Probably no. So my take-home message now, NC balloons showed a very promising results, but standardization of inflation, deflation, time, and techniques is a must. Better understanding of plaque morphology is deeply needed to have a better outcome and for a better patency rate for medium and long-term period. Improvement of balloon materials and folding techniques is also required, and IVAs and upgrading of imaging technology, as we heard earlier today, is very important for the proper sizing, proper evaluation, and proper improvement of our break techniques. And finally, specialty balloons may play a role, an integral role in the future. But what you have to keep in mind, you have to keep the normal physiology as it is, the normal hemodynamics. You have to maintain everything for below the knee segment just to provide this with a good outcome. Thank you.